Today, we're diving into a fascinating paradox at the heart of one of the world's most efficient healthcare systems. It's a system that gets a ton of praise for its quality and its results. But just beneath the surface, a major crisis is brewing, one that could threaten its biggest accomplishments.
Okay, let's just start with this number 81%. What's that about? Well, get this. On 81% of health indicators, Israel's health system actually performs better than the OECD average. And here's the real kicker. It does all this while spending less money than most other high-income countries. I mean, that is just a stunning level of efficiency.
And this isn't some outside opinion. The people leading the system, like Sefi Mandelevich at the Ministry of Health, they feel it too. You can tell there's this real pride in what they've built, how high quality and nimble their healthcare really is.
Which, of course, leads to the big question. If the system is so great, what's the problem, right? Well, it turns out all this high performance is hiding a pretty severe and honestly a self-inflicted wound that could undermine the whole thing.
So let's really unpack this paradox, because it's a story about how yesterday's brilliant solutions can create tomorrow's biggest headaches. And, well, the clock is ticking.
And you can really feel the urgency coming from inside the system. Listen to the language here. A top health official isn't just calling the doctor shortage a challenge. He's calling it a tsunami. And he's even circling a date on the calendar, 2026. That's when the clash hits. So how on earth does a top-tier system end up on a collision course like this? Well, it wasn't just one thing. It was this perfect storm of demographic changes and policy decisions that, at the time, probably seemed like a good idea.
This timeline basically tells the whole story. Back in the 90s, you had this huge wave of doctors coming in from the former Soviet Union. It was a lifesaver, a massive boost. But it also kind of papered over a long-term problem. Israel wasn't training enough of its own doctors. Fast forward to today, and that whole generation is starting to retire. And that's happening right as a 2019 reform, which was meant to keep standards high, ended up cutting off a major pipeline of new doctors from overseas schools. See how it all comes together? It's all pointing to that 2026 deadline.
And this chart, this really puts it all in perspective. Just look at that. 58% of physicians in Israel were trained abroad. That is more than any other developed country. The system has been deeply dependent on this flow of doctors from the outside for a long, long time. And that's what makes that 2019 reform such a massive shock to the system. And hey, it's not just about doctors. This whole problem gets even worse because of a nursing shortage that was already there. Israel has just 564 practicing nurses for every 100,000 people. I mean, that is way below the European average of 838. So that just adds another huge layer of pressure on everyone. But here's what's so important to understand. This isn't just a numbers game that affects everyone equally. No, this is a crisis of equity. The communities getting hit the hardest are in the periphery, in the north and the south, where hospitals relied heavily on residents from those overseas schools that are now disqualified. We're talking 60 to 70% of their residents. That's a huge blow. Okay, so faced with this coming tsunami, Israel isn't just sitting back and watching. The country's launching this incredibly ambitious, multi-part response. And it all starts with a huge shift in thinking. They have to grow their own talent, right here, from the ground up. And the absolute centerpiece of the strategy is this, a massive expansion of their own medical schools. I mean, just a few years ago, they were admitting about 800 new medical students a year. The goal now? To more than double that, getting up to 2,000 new students every year. That's a huge investment, not just in buildings, but in the teachers and the resources you need to train that next generation. But you know, it's not just about the raw numbers. It's about getting doctors to the places that need them most. To fix that equity crisis, they're launching these very specific programs. They're giving out scholarships to students who actually come from the periphery, with the idea that they'll be more likely to go back and serve their own communities. They're even borrowing something called the Norwegian model, where they'll pay for students to go to good schools in Europe, but with one big string attached. You have to come back and work in one of these underserved areas. And at the same time, they're also trying to make it easier for qualified doctors who do want to immigrate. So for specialists coming from places like the US, the UK, and Canada, they've just gotten rid of this mandatory 3 to 6 month adaptation period, which was a pretty big piece of red tape. Now here's where it gets really interesting. The response isn't just about adding more doctors. The plan actually involves innovating the whole structure of healthcare, trying to make the entire system more flexible and more resilient. A key piece of this is a huge expansion of the nurse practitioner role.
the NP role. And these aren't just nurses. These are highly trained pros with graduate degrees who can step in and fill some really critical gaps in patient care.
So what can they actually do? Well, in Israel, NPs can now specialize in over 17 different fields, everything from diabetes care to geriatrics. They can prescribe certain medicines, they can refer patients to other specialists. Basically, they can take a significant amount of pressure off of physicians and, in the process, make it way easier for patients to get seen. It's all about letting everyone in the system do the most they're trained to do. Here's another really smart approach. They're investing in their physician scientists. They've created these new national programs that give doctors dedicated paid time to do research. And the thinking here is twofold. First, research leads to better medicine, obviously. But second, giving doctors time to pursue their academic interests is a really powerful way to prevent burnout and to keep your best people from leaving.
And this innovation goes all the way down to how new doctors are being trained. Medical schools are now using AI simulators to teach students some of the most difficult, soft skills in medicine, like how to break bad news to a patient's family. It's a really high-tech solution to make sure the next generation has both top-notch clinical skills and real compassion.
So, with this massive multi-front response underway, you have to wonder, is it going to be enough? Will it be enough to stop that tsunami before it hits? What's the road ahead look like? Well, the leaders in the system, like Sefi Mandelovich, they seem pretty confident. And he points to this core national trait, agility. The ability to see a problem and pivot really, really fast to find a solution. In healthcare, that means quickly expanding schools, rethinking jobs, and cutting through red tape. This crisis is basically a massive test of that agility. But in the end, success here isn't just about hitting a target number of new doctors. The real question, the one that truly matters, is whether this ambitious plan can build a genuinely resilient workforce for the future, one that doesn't just meet demand, but also maintains those high standards of quality and fairness that made this remarkable, paradoxical system so special in the first place. Thanks for joining us.